Let us now go to etiology in Chinese medicine. The topic is rheum and blood stasis. Like phlegm, rheum is generated when the climatic evils or inappropriate food and drink disrupt water metabolism, or when the passions disrupt the transforming ability of the lung, the spleen, the kidney, and the sanjiao. In general, it is a thin and clear fluid that can accumulate in various parts of the body. Rheum in the intestines may cause abdominal gurgling or rumbling. Rheum in the chest wall may cause swelling and fullness and pain on coughing. Rheum in the chest cavity may cause chest tightness, coughing, shortness of breath, inability to lie flat, and puffiness. Rheum in the superficies may cause general edema, absence of sweat, and heaviness of the limbs. Blood stasis. This is an accumulation of stagnant blood. Static blood includes blood that has left the meridians, or blood that is blocked in a meridian or an organ. As a product of an abnormal process, static blood can also cause illnesses, since it can lead to pathological changes. Now let's look at the formation of blood stasis. Disease evil lodged in vessels. Both exogenously and endogenously caused illnesses can lead to the blood stasis. Among the external causes of illness, the cold evil is the most likely because of its nature to contract and gel. When the heat or fire evil lodges in the vessels, they boil and concentrate blood, or the heat evil blocks blood flow and forces the blood to extravasate. In both cases, they induce stasis of blood. Excessive emotional upheaval can cause blood to flow abnormally, in that way also fostering blood stasis. For example, depression may lead to the stagnation of liver qi, and rage can lead to abnormal ascent of blood and qi. In both cases, blood stasis may result, stabbing pain in the chest, ribs, or in the head. Disharmony of actions of visceral qi and blood. The normal circulation of blood and fluids depends upon the cooperative actions of the Zangfu viscera. Any significant disturbance of these actions can cause impedance to blood flow and lead to blood stasis. For example, if the lung loses its diffusion or the liver loses its dispersion and depuration and facilitation, then qi is impeded and blood stasis can form. When heart qi is deficient, there is not sufficient motive force for blood circulation. When spleen qi is deficient, there is no control over blood, so that blood extravasates. Trauma. Physical trauma or carrying excessive burdens can all lead to local stagnation of qi and blood or injury of the collaterals and lead to blood stasis. Different kinds of bleeding can also lead to blood stasis. For example, bleeding in the visceral organs, bleeding under the skin, and bleeding following childbirth. In addition, chronic diseases can lead to qi deficiency, loss of motive force for blood circulation, and blockage of the meridians. Under such conditions, blood stasis can gradually develop. Now let's look at the characteristics of static blood-induced conditions, variable location, and manifestations. This characteristic is due to the fact that blood stasis can develop in many different areas and it can result from many different factors. This can be illustrated by many examples. Blood stasis in the heart can produce palpitation of the heart, chest tightness, precordial pain, and cyanotic nail beds and lips. Blood stasis in the lung can produce chest pain and hemoptysis. Blood stasis in the stomach and the intestines can produce hematemesis and melena. Blood stasis in the liver can produce flank pain and abdominal mass. Blood stasis attacking the heart can induce raving behavior. Blood stasis in the uterus can produce pelvic pain, irregular menses, painful menstruation, amenorrhea, and vaginal discharge of dark purple clots or metrorrhagia. Blood stasis in an extremity of a limb can produce deep ulcers. Localized blood stasis elsewhere on a limb can produce circumscribed purple and painful swelling. Here are some common features of static blood-induced conditions. There's squamous and dry skins, blackish complexion, cyanosis, ecchymosis, pain, stabbing pain, tumor, bleeding, thread-like uneven pulse. Stasis in the lung will have expectoration and hemoptysis and pain in the chest. Stasis in the heart will have chest congestion, purple lips, and angina pectoris. Stasis in the epigastrium or abdomen will have hematemesis or blackish stool. Stasis in the uterus will have lower abdominal pain, masses, and irregular menstruation. Stasis in the extremities will have numbness and pain of extremities or atony of limbs or paralysis. The common characteristics. Though the diseases and conditions caused by blood stasis are so different, they still share some common characteristics. Pain. It is mostly stabbing, fixed in position, and more severe at night. With swelling, it is fixed in position. If due to trauma on the body surface, it is partially purple. If internal, it is mostly felt as a mass that is hard to the touch. Bleeding. The blood is mostly dark purple in color or contains clots. For lusterless skin and nails, the complexion is dark or cyanotic. The skin is dry and rough, and the lips and nail beds are cyanotic. Tongue appearance. The tongue is purple and dark and sometimes speckled with purple spots. The vessels under the tongue may be purple with varicosity. And the pulse is mostly thread-like and impeded, deep and taut or intermittent. Thank you so much for your attention.